Hello and welcome to Pregnancy Info. Today we will discuss the care after miscarriage. Do you know what is miscarriage? For some, the loss of a pregnancy can be very hard. You may wonder why it happened. Miscarriages are common and are not caused by exercise, stress or sex. Most happens because the fertilized egg in the uterus doesn't develop normally. There is no treatment that can stop a miscarriage. If you are having a miscarriage, you have several options as long as you don't have heavy blood loss, fever, weakness or other signs of infections. Now, you can do care of yourself at home. A number of ways, I have discussed them in this video. You will probably have some vaginal bleeding for 1 to 2 weeks. It may be similar to or slightly heavier than a normal period. The bleeding should get lighter after a week. Use sanitary pad until you stop bleeding. Using pads make it easier to monitor your bleeding. Make an over-the-counter pain medicine such as acetaminophen or Tylenol for cramps. Talk to your doctor before you take ibuprofen or naproxen. Read and follow all instructions on the label. You may have cramps for several days after the miscarriage. Don't take 2 or more pain medicines at the same time unless the doctor or midwife told you to do so. Many pain medicines have acetaminophen, which is Tylenol. Too much acetaminophen can be harmful. You should take rest if you had a miscarriage in your first trimester. Unfortunately, if you were in your first trimester when the miscarriage happened, you need to take rest for at least a week, and the miscarriage done in 6 to 8 weeks, then you should take complete bed rest for 1.5 months in this case. Ask your doctor when it's okay for you to have sex, otherwise avoid it for almost 2 months. You may return to your normal activities if you feel well enough to do so, but remember in your mind that you don't lift the things heavier than a kid of 1 year. So weightlifting will cause some problems in your genital part at this stage. If you would like to try to get pregnant again, it is usually safe whenever you feel ready. Talk with your doctor about any future pregnancy plans, but recommended is after 6 months of miscarriage. If you don't want to get pregnant, ask your doctor or midwife about birth control. You can get pregnant again before your next period starts if you are not using birth control. You may be low in iron because of blood loss. Eat a balanced diet that is high in iron and vitamin C. Foods rich in iron include red meats, shellfish, eggs, beans, and leafy green vegetables. Foods high in vitamin C include citrus fruits, tomatoes, and broccoli. Talk to your doctor about whether you need to take iron pills or multivitamins. Don't douche. Douching after a miscarriage is a complete no. Plus, the women should also avoid using vaginal washes during this time. No intense workout sessions. This is the time when you should take rest to recover from the physical trauma of a miscarriage. Gymming, weight training, etc. are not recommended right after a miscarriage. If you want to exercise, then you can opt for yoga and some breathing techniques that will also keep you stress-free. For some, the loss of pregnancy can be very hard. You may have a range of emotions. If you need help coping, talking, a family member, friend, a counselor, or your doctor may help. When should you call for help? Call your doctor or nurse to seek immediate medical care. If you have severe vaginal bleeding, you are passing blood clots and soaking through a pad each hour for 4 or more hours. Your vaginal bleeding seems to be getting heavier, or you pass blood clots larger than the size of a golf ball for more than 4 hours. You are vomiting or cannot keep fluids down. You have new or more belly pain. You have a fever. You have signs of infection such as headache, muscle aches, or dizziness. Even if you don't have a fever, you might still have a severe infection. You have vaginal discharge that has increased the amount and smells bad. So this is all about the care after miscarriage. You should do it and also spread this knowledge to the female who are suffering the miscarriage. And if you like the video, then share it and also subscribe our channel. Thank you.